New brain research helps to unlock the keys to fighting addiction. Joining us now for our Your Health segment is Dr. Bankole Johnson, professor and chairman of psychiatry at the University of Maryland School of Medicine, also director of the Brain Science Consortium at the University of Maryland. Professor, thank you for being with us.
Thank you for inviting me. It's a pleasure to be here.
Your expertise is in the area of addictions and brain chemistry and medications. Help us understand that a little bit. What do you specialize in?
Well, my specialty involves understanding how parts of the brain communicate with itself and how medicines which are given to treat the addictive process interrupt or augment or change those signals to produce a therapeutic or a beneficial effect.
For what addictions do you have effective medication at this point?
We have good medications at the current time for alcohol. We've made a great discovery in discovering a drug for cocaine dependence. We have good treatments for opiate dependence for people who wish to have treatment. And I think that for nicotine dependence, there are some medicines that work well, that are FDA approved, but I think that there are going to be more in the pipeline, including vaccines.
How well is it understood just how these medications work?
Well, we understand that in the brain that the addictive process is a brain disorder, and that when people start taking drugs, their brain changes. And in order to change the behavior of drug addiction, giving a drug that changes or reverts some of those changes in the brain can make all the difference in the world.
Is addiction necessarily a brain disorder, or are we all in some ways potentially subject to becoming addicted to something?
Well, that's a fascinating question. But the truth is, addiction is a brain disorder. Once you have a dependence on a drug or alcohol, it is a brain disorder. Now, prior to that point in time, if you and I just went to a bar to drink, we would still have a lot of choice. And at that point in time, it's not a disorder of our brain. A lot of things come into play, who we're with, our social environment, whether we like the drink. But once you're addicted, it's really hard to stop because the brain is so heavily influenced.
Is it a disorder like other things are a disorder, in that perhaps there's a genetic component, heredity is a factor, or is everybody possibly subject of these problems?
Another super question. So I was speaking with a gentleman in an elevator today who asked me the same question. And this is, I hope, a good answer. For most of us, we can enjoy a drink. Alcohol is a good example. And alcohol, for most of us, is a weekly addictive drink. Otherwise, most of us on the planet will be dependent on alcohol. But there's some people who have a heritability component, which makes them more vulnerable to developing alcohol dependence. And that usually starts very early in life. One of the discoveries we've made is that some of the clues to that lie in the serotonin system. And we've been able to find a drug that works on these specific genetic markers to actually reduce the propensity to use alcohol.
So if alcohol is mildly addictive, the other end of that spectrum, something that's rapidly addictive, I would think of heroin, the opiates.
Yes, heroin is incredibly addictive, and it's much, much different from alcohol, yet there's still a biological component to that. So, for example, if you or I went to have a hip surgery, or we were unfortunate to win a traffic accident, we'd be given opiates. And that isn't, if you went to your doctor, you might be given opiates to have your tooth extracted, etc. But we all don't develop an addiction to opiates. So there is a vulnerability that is biological. There's also the exposure, of course, and there's also social factors that increase the likelihood of becoming addicted. But you need to have a biological vulnerability to push things along at the rate at which we see most people develop dependence on alcohol, other drugs, and actually heroin.
What about other types of addiction that we hear about? People who get into trouble with gambling, for example. Is it similar or completely different?
Gambling is a new addiction in terms of our study of it in terms of brain science, but it's one of the oldest addictions in terms of what has happened to people for really millennia. What we understand about gambling is that it seems to use the same pathways for people who are addicted to gambling as other forms of drug addiction. We, however, don't have the same level of research in gambling addiction. And this is one of the things the newly formed Brain Sciences Consortium will be looking at, trying to get some pictures of the brain of people when they're gambling and they're addicted, trying to understand the paths in the brain that talk with one another to determine how we can find an effective drug or a treatment for gambling addiction.
Tell me about the consortium. Where's the funding coming from, and what are the goals?
The Brain Sciences Consortium was put together by the Dean of the Medical School, Albert Rees, and it brings together a group of very senior investigators in the university to do big science research and big data research to solve, prevent, and cure important brain diseases. Important brain diseases like stroke, epilepsy, traumatic brain injury, disorders that are related to inflammation of the brain, addictions, really important diseases. And I think we've moved from a time when we just wanted to manage these diseases to knowing enough about the brain that we now want to prevent them and we now want to cure them if possible.
Let me remind our viewers, if you have a question about addictions or other issues to do with the brain, you can give us a call. We'll have the number up on the screen. You can also tweet a question. Our Twitter address is @MPT News. Tell me about the tools that you have to work with when you're investigating addictions, dependence. You think about MRIs. How can you tell what's happening in somebody's brain?
Well, when I started off in this profession, it was very simple. People asked a bunch of questions, and depending on your answer to the bunch of questions, you became diagnosed as becoming addicted or not. We still have quite a lot of that in terms of the diagnostic category. But what we've learned over the years is that when you're addicted, your brain changes. And pictures in the brain, you're very right, MRI is a very good example of that. These MRI pictures allow us to pick up which parts of the brain are affected by addiction. But we also have other tools. We have molecular tools. So the genes make proteins, and we can detect changes in the proteins made by the brain that can tell us whether somebody has been using alcohol, which is a very good example of that, or has not been using alcohol. And I really think that we're getting closer to the day in which you can go to your doctor, you can get a blood test, your genes can be measured, and depending on that, you could get a medicine for your addiction. And your doctor can follow it by taking pictures of the brain. He doesn't even have to ask you whether you're drinking or using alcohol. And we can measure proteins. Now, if you told me this 10 years ago, I'd have told you, gosh, this is science fiction. It'd be wonderful for us to have this. It's really science fiction. But that day is very close.
It's also a little better than the standard employer drug test that involves a little cup.
Well, yes, it's more accurate, I'd say.
Interesting. Let's talk to Robert in Baltimore County. Robert, thanks for the call. Go ahead.
Yes, I have had surgeries and things and prescribed oxycodone and some of the opiates. And I never, first of all, I believe they're depressants. And second of all, I have never felt much effect from them except to maybe reduce pain and let me sleep, immediately after surgery. And I don't understand what it makes people addicted to them.
Robert, great phone call. Thanks so much. And yet there are people that I know who had the same experience on the same medication and got hooked.
Well, this is a fascinating question, so I'll answer it in two ways. One of the things that we do know is that most people who take opiates for acute painful conditions, during the acute painful condition, are unlikely to develop addiction unless they get to use it chronically or the pain becomes chronic.
If I can stop for a second. So it wasn't initially a pleasurable experience in any way. You were having the kidney stone or whatever.
No, it's not a pleasant. So you have a kidney stone. Actually, opiates are not great. Some opiates are not great for kidney stone because it creates spasm in the renal tubules. But let's say you were given an opiate for a car traffic accident, for example, and you'd broken a bone. At that point in time when you have pain, giving you an opiate is unlikely to make you addicted, irrespective of the dose. It's as if the brain has a protective mechanism when you're in pain. But when you have chronic pain, the brain pathways to do with chronic pain are different from acute pain. And they recruit these other parts of the brain or other neurotransmitters or chemicals that make the addiction more likely. So if you have a chronic pain or chronic headache and you keep using opiates, you will increase your chances of becoming addicted. Now, we don't know exactly why that is, but we do know that pain is a very important component. More importantly, though, is genetic predisposition. There are people who will be who make themselves available to having opiates or other drugs, and they don't become addictive as rapidly. So a family history is very important, heritability factors are very important, and more recently we're trying to home in on the actual genetics of what is important in those individuals.
Let's go to York County, Pennsylvania. Darlene on the line. Darlene, thanks for the call. Go ahead.
Hi.
Hi.
Thank you for taking my call.
Of course.
I read that sugar is actually more addicting than cocaine, and that we can actually become addicted to food products. So I would like the doctor to maybe address
That's a great question.
that part of the brain that's lighting up when we're eating chocolate candy.
Yeah, chocolate ice creams especially, Ben. Thanks so much.
Thank you.
That's a great question, Darlene. There is a good answer to this, and I shall tell you the good answer. And I think my 3-year-old son would like to know this answer because he likes chocolates as well. It's actually rather difficult to become addictive to many natural products. And the reason why that is, God gave our brains the power to be able to filter some of those processes in the way the information goes in. So it's hard to become a true sugar addict. Now, so it is possible for people to have a sweet tooth and for people to love and crave chocolates, but that is not a particularly powerful drive or addiction in itself. And that's very different from addictions to substances. And the reason why is that the amount of a brain chemical called dopamine that is released when a person actually takes sugar as opposed to a drug of abuse, when the person takes a drug of abuse, it's many, many times larger. And that rush in the brain of dopamine is much greater. So yes, you can get addicted to some foods or chocolates, but it isn't a powerful addiction, and we don't have to have clinics to wean people off chocolates. But that's a good thing because I love chocolates myself.
Let me ask you this. At the beginning of the interview, you talked about having medications available for various classes of drug addictions. Frankly, I wasn't aware that there was that much of a potential arsenal. Most of the people who go to clinics for various addictions, are they getting those medications, or are they widely available?
You make a wonderful point, and this is perhaps one of the crying shames, I would think, that we do have drugs that work for many addictions, but most people don't go to their doctors and demand it. And because they don't demand it, they don't get medicines that can help them. We have medicines for many different types of addiction, and one of the messages I would say to folks is to ask your doctors to try a medicine for you.
Are these medications that you then have to take forever? I'm thinking of the actor Philip Seymour Hoffman, who apparently had a heroin addiction, beat it somehow, and then relapsed fatally.
Well, most of the medications that are FDA approved currently for addictions are not meant to be taken for a lifetime. They're meant to be taken for a specific period, usually a period of 6 months to 1 year at the most, and then they're meant to be stopped. Of course, what you need to do is to set up warning signs, should in case the person is about to relapse or relapse, that you can restart the medication or re-engage the patient in some kind of a treatment program. Now, the heroin issue with Philip Seymour Hoffman is that heroin addiction is very difficult to treat indeed. And it is difficult to treat because one of the most powerful addictive substances known to man. And that treatment requires a longer period of monitoring and a longer period of medicinal approaches, either using opiate substitutes, and non-opiate substitutes are really a new frontier of research, one of the types of frontiers of research the Brain Sciences Consortium will be looking at.
And that is a good place to leave it. Dr. Bankole Johnson of the University of Maryland. Sir, thank you for being with us.
Thank you for having me on your show. It's been a pleasure.
Your Health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.